UHC means it reflects the desire that people want their health system to offer the assurance that the services that they might need to use are available, good quality, and affordable. And I think we all have that hope, but it's only in the higher income countries that actually happens at the moment.
One of the reasons that UHC has become even more prominent in the global health agenda is also due to the fact of what happened during the Ebola crisis. They clearly highlighted that sort of vertically driven development assistance does very little to help support systems interventions that systems that need to be in place in an emergency.
I hope you see the kind of natural link with the introduction of universal health coverage. Because the institutions and the data that are set up to institutionalize universal health coverage also hold the possibility for improving quality of care.
Basically, the idea was to try to create a group of partners that agree to work together in a coherent way to support countries in the area of health financing and social protection.
Economics does play an important role. So having the necessary resources to cover a certain amount of the population was necessary.
And most of those countries, the low-income countries, wouldn't get to a near acceptable level of health expenditure from domestic resources until the 2040s. Not even the 2030. So it's not true that they can afford UHC themselves.
Even if we had all the money in the world, whether a country or not has UHC is a political issue.
Try to go beyond the technical issues because very often the problems in the countries cannot be solved only by technical solutions but also by a leadership approach.
The way we look at quality is always as one part of the overall health system. We link quality to population health and health system development. And in the way how we look at health system development, we see that the bond of the healthcare system is one of the determinants of population health, alongside non-medical determinants of health, such as behavioral and environmental factors.
We know some of the technical solutions, but getting them accepted politically is difficult.
Because the problem was that many countries were benefiting from a lot of different support from different players, different stakeholders in an uncoordinated way and leading to fragmented situations in the countries where you have a lot of different schemes.
Politics matter. That historical precedent matters, so where a country is coming from matters. And for successful implementation of political economy and understanding thereof matters a great deal.
UHC is important not just at the international level. It's most important for countries. And many low and middle income countries have adopted UHC as the goal of either the health system or the health financing system.
In a review of that literature, we found that theoretically that left labor coalitions, the wealth of nations, and how fractionalized societies are play a huge role in designing welfare policies, including universal healthcare coverage.
But I think it's important to address the issue how the introduction of universal health coverage can be linked to the strengthening of the assessment and the improvement of quality of care.
One of the job of the P4H network was to try to have coherent documents or help the country to have coherent documents that you don't have one document saying one thing and the other one saying the opposite.
So I think there are some storm clouds in UHC over the next 15 years, and there's something that we have to be very aware of, that it's not going to happen unless we can persuade governments to allocate more resources to this, unless we can persuade the richer countries to allocate more resources to this as well.